to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today we're going to be discussing belly binding with our guest, Jesika Wachter. Jesika Wachter is the creator and owner of The Parent Garden, a support network for postpartum families. Jesika is both a professional postpartum doula and a licensed massage therapist. To fulfill a lifelong interest in the human body, she attended the Academy of Massage Therapy in Jersey City, New Jersey, and passed the New York State licensing test. She has since become a trained and certified doula, placenta encapsulator, infant massage educator, baby wearing consultant, and breastfeeding counselor. That was a mouthful. Jesika has worked to educate and prepare expectant families for what is considered the fourth trimester. The fourth trimester, or the postpartum period, is often overlooked as expectant families focus on childbirth and fail to plan and prepare for life with a new family member. Jesika provides a unique combination of tools that lays the groundwork so that new parents can relax and enjoy this beautiful and tender period. She currently resides in Morris County, New Jersey, with her husband and 2 dogs. For more information, please visit her website at parentgarden.com. Welcome, Jesika.
Hi, thank you so much for having me.
Yes, so this is a really cool topic that we're focusing on today regarding belly binding, and it's a topic actually that I don't really know much about, and so I'm sure a lot of our listeners are not familiar with it as well. So please tell us, what is belly binding?
So basically belly binding is where we wrap the belly during a woman's postpartum period. So you're wrapping the belly, the abdomen, the torso in order to shrink and recover her body in a shorter period of time, which is normally around 6 to 8 weeks, so we try and lessen that. So it's basically like 360-degree support. So it assists in abdominal wall muscle retraction. It helps to improve her posture. It stabilizes loosened ligaments, and it just provides support to the torso while everything gets back into its original positioning.
Mm-hmm. Yeah, I mean, that makes so much sense to me as a chiropractor because after giving birth, like you mentioned, the abdominal muscles are really stretched and the ligaments are still loose. The relaxin hormone is still in your body after giving birth, so it's so easy for the joints to shift out of alignment. So this is like almost like a corset, it sounds like, to help provide support for the alignment.
Absolutely. Yeah, no, I was going to talk a bit about that because there's so much that happens to a woman's body during pregnancy that kind of shifts out of whack that we're not used to. Right. And just belly binding is just kind of helping us get back to that pre-pregnancy state so that we're well adjusted.
Yeah, I love that. So tell us a little bit more about how it can be beneficial after giving birth.
So I was going to talk a little bit about what happens to her body during pregnancy. So she's going to retain a lot more water, fat, and air, and that causes her body to swell and expand. Obviously, it's supporting the amniotic fluid. It's enabling her body to cushion the baby and all of her internal organs and bones. But with all of this, her center of gravity tends to shift as the baby grows like larger and larger. And this is a lot of times when during her last month of pregnancy, she'll get more and more swollen, right?
Right.
So when the baby is born, all of that excess, the water, the fat, the flatulence, it's just no longer needed. So all of the cells naturally release and shrink, but it's going to take time for this to happen. So that's why ultimately wrapping and binding is going to speed up the process. Mm-hmm. Let's see, the abdominal wall, right, usually can stretch as much as 50% during pregnancy. So your ligaments and your muscles are stretching and thinning, and you've got that hormonal cocktail that's just like making your body just grow and expand and accept this beautiful pregnancy. But it's also causing everything to soften and separate, and it's going to weaken your muscles and whatnot, and it can cause a lot of back pain. So we want to bring that all back in together. So with regards to the spine, your posture is greatly affected. So your hips and your pelvis tend to tip forward and counterbalance the weight of the baby.
Mm-hmm.
And it causes your pubic bone and tailbone to move backward. So you're getting a lower back arch. So a lot of times that lordotic curve is creating a lot of pressure on her spine. And then her upper spine is simultaneously responding to this change. So your shoulders are moving forward, you're collapsing the chest, and your head is kind of jutting forward. So that's a kyphotic posture. So you're getting that classic S-shaped spine, right?
Mm-hmm.
And that, you know this. You're the chiropractor, right? So a lot of this moving and shifting of the center of gravity, it's affecting her nervous system, and it can cause lots of aching, lots of weakness, and sometimes even numbness, right?
Right, and even beyond that, it's impacting the organ function because that's where the nerves are going from the spine.
Absolutely.
Yeah.
So lastly, I just wanted to talk about the pelvic floor relaxation. It's pretty much the base of your core muscle system, which is attaching the abdominal muscles and your sacroiliac joints.
Mm-hmm.
That's always a mouthful for me. So basically your pelvic floor is providing balance and body stabilization. So during pregnancy, because of, again, that hormone cocktail, it's allowing everything to stretch and loosen and open so that baby's birth can be made possible. But after all of this happens, mama feels a bit wobbly on her feet, and this can remain loose for up to 5 months post-birth.
Mm-hmm.
So it's supporting your lower intestines and your colon and your bladder. But it's that all of those organs are being less supported post-birth because of all of this opening and stretching. So a lot of times that's why women suffer incontinence right after birth, because everything's loosened. So,
right, there's weakness in the pelvic floor muscles that is making it difficult to control the urine flow.
Exactly.
Mm-hmm.
So because of all of this, and because of all of this loosening, we aim to kind of help her body get back into a place of function and solid support by wrapping and binding so that we kind of close her body. You know, pregnancy and birth is opening, and then with belly binding and wrapping, we're aiming to close it and to seal it. So, which I think is a beautiful way to think about it.
Yeah, it is.
And then also we want back support. Mom is bending over a lot. She's picking up baby. She's carrying baby. She's breastfeeding. A lot of times mom slouches and bends over and doesn't realize that, she's slouching. A lot of times we tend to bring breast to baby as opposed to baby to breast. And a lot of times when I've wrapped moms, I feel like I've heard them go, I'm sitting up so much straighter and I feel so much more supported. And, it kind of helps facilitate that proper support so that they can take care of their body better.
Right, better posture through the support of the wrapping.
Exactly. So we're aiming to wrap from right below the breast until the pelvic bones. So you're getting a full area of support.
Great. That sounds really cool. So this can be done after a woman has a C-section or a vaginal delivery?
Absolutely. I feel like, obviously, with a vaginal delivery, it's great. But after cesarean, we're a little bit worried about the incision site and whatnot. So we wait a little bit longer, say about 2 weeks before wrapping, because we want to make sure the incision site has been healed. But once we start, it's really going to help support the muscles around that site. And it protects the incision also, so it helps reduce pain there. And there's sometimes some flabby skin that can kind of sit over the incision site. With wrapping, it's going to kind of pick it up and pull it away so it doesn't lie against the incision, and obviously that will help the body heal better.
Yeah.
And then also, she's just gone through, major abdominal surgery, so having the support there helps her be a little bit more mobile and active while she recovers.
Yeah, it's so cool. So after having the C-section, you wait 2 weeks before you start the binding. How soon can you start after a vaginal delivery?
We usually suggest like 4 or 5 days after.
Okay.
And then you start wrapping it, and then it depends on mom and how she feels, but a lot of times I like to recommend at least 8 hours a day. She can wear it while she sleeps, and then at least up until like 40 days post-birth, if not longer, depending on how you feel you're healing. And with regards to the wrap that I'm talking about, which is the Malay version, you need someone to help you get into it, but it's rather comfortable, so you can take it on and off when you need.
Oh, I see. Okay, so she has help getting into it, and then could potentially wear it all day and then just remove it, like let's say for bathing?
Exactly.
Okay.
Exactly. Yeah, so it's whatever, she's most comfortable with. If she's like, sick of wearing it and uncomfortable, don't wear it. But we recommend, as long as you can, just to kind of get everything back into its original position.
Mm-hmm. So really even up to 24 hours if she needs to.
Yeah.
Or longer. Okay. And then you said about 40 days she wears it, and obviously everyone's individual, but that's the typical amount of time to get that support and help with the healing.
Exactly. And, everyone's individual, so I always recommend moms to really listen to their bodies and pay attention to what's going on so that, they're their best advocate. They know what's going on. So listen to your body and you'll know when you're ready to stop or continue.
Mm-hmm. And so you mentioned the Malay version of this belly binding. So this sounds like this is a pretty old technique that's been utilized for a while. Can you tell us about the history?
I don't know too much about the history, actually, but I know that it comes from Malaysia and that it, typically this is where we found they practice a 40 days of lying in period, which is where mom is completely catered to and taken care of. And then with that, having this binding completed during that time is where she's helping get herself back together again. And because it is such an ancient tradition, they don't use Velcro or snaps or clasps or anything. So it is technically just a cotton fabric, like muslin. Mm-hmm. It's about 13 to 17 yards in length, and then depending on the size of the mom, and then 8 inches wide. So basically, mom holds on to the tail end, and someone will assist her, and they will wrap around her body in a tight form starting at the pelvis bone, and then twist the tail around once. It's kind of hard to explain verbally without seeing it, but it's just a continuous wrap around, twist, all the way up until right under her breast, and then you just tuck in the ends. So it's really flat. You can wear it under clothes. It's beautiful because it fits directly to her body. There's no bunching or scrunching or shifting or twisting. It really lays right nicely against her figure.
Mm-hmm. It's custom.
It is custom.
Yeah. So that's the difference with the Malay version compared to perhaps like pre-made belly binders. Tell us about those.
Correct. There's 5 that I can note that are on the market. The Cinch, especially for mom postpartum support. Belly Bandit, which I think is one of the more popular versions. There's one called Touts and another one called The Squeam. They're all similar but different. Some of them you can just pull up and, shift onto your body. Others wrap around, so it'll be like an elastic, which you'll wrap around and then use a Velcro closure. Everybody's different, and as you shrink and as your body goes back into its pre-pregnancy state, I don't know if every one of those binds are going to work as you shrink, whereas the Malay version definitely will because it's designed specifically for your body. Things I've heard about the pre-made belly binders, they can shift or bulk out or like not cover enough of area. and they might not fit well under your clothing. They can be stiff and uncomfortable. So I guess it just depends on. I know a couple of moms who've tried several different ones, and it's, you don't want to waste money on trying to find comfort.
Right, but I think it's good to note that if you buy one and it doesn't work, it doesn't mean that belly binding isn't for you. It just may mean you need to find a different binder.
One for you.
Yes.
Right, and I'm not saying that these don't work, because they absolutely do, and I think that they're a great option.
Okay, and you can find them like online?
Absolutely, with ease.
Mm-hmm. Now, what if somebody does want the melee version, and how can they find someone who does that in their area?
I do sell them, so I make them myself.
Oh, okay.
For me, but also I know that there are a bunch of other really wonderful women out there that sell them too, so a quick Google search will usually turn something up.
Okay, so they could go to your website at parentgarden.com and order that wrap from you, and then have their partner would be able to help them put it on?
Absolutely, and I would send a link to a video that would show them how to actually do it, so they have good guidance.
Okay, that's really good to know. And these things are washable? You just throw them in the
It's
washer?
Just cotton, like organic cotton, so yeah, absolutely.
Sounds so great. I loved your description about the Malaysian tradition of the mother staying in for 40 days and being supported. And this belly binding is providing the physical support, but you were alluding to the emotional support and all the other support this mother was receiving during those 40 days postnatal. And I just think sounds so beautiful, and I wish that for more women, especially in the United States.
I feel like in this day and age, we're so quick to rush back to our normal lives, and I think that the postpartum period is just such a beautiful time, and we should just kind of respect and honor that and give ourselves a little break and get to enjoy, this wonderful thing that we've created. And it's a shame that a lot of people don't have support.
Yeah.
So that they can spend 40 days, being catered to and mothered and loved. But I think if you are able to do that, then it's something that's great to plan for.
I was ready to say, some of this just may require a little bit of planning ahead during the pregnancy to set up a support network of friends and family and even perhaps paid support that are coming and helping you at home, cooking, cleaning your house, and just everything that goes into running a house.
Errands.
Exactly.
Absolutely. I feel like, and I love that you just pointed out, it may take a little bit of planning.
Yeah.
And I think, every parent goes, I hope, fingers crossed, everyone goes for childbirth education, right?
Mm-hmm.
And it's very important for them to understand that before giving birth, but what happens after? Like, why are we not preparing for our postpartum period? Because that's longer lasting, right?
Right.
that's like, I don't know. I feel like,
life.
Yes, I think it's awesome to take a little bit of time while you're nesting, get that energy going, and figure out what you can do and how you can find support for yourself afterwards.
Right, and I know, we're in the New York City area, and a lot of women in this area don't necessarily have family that live nearby. Sometimes, hopefully, mothers or mother-in-laws can come in, but if not, it's worth the money to hire support because it's overwhelming, especially for a first-time mom, for her partner, and they've never been parents before. There's so much of a learning curve that's occurring that you want to have that support. You don't feel like you're just overwhelmed and just drowning and not really cherishing those precious moments that are, limited. These are not going to be, your baby doesn't stay small forever.
It's true. I know. I hate to always bring that up because it's like, your baby won't be small forever. Enjoy it. But there's so much going on. Your body's recovering. Your hormones are recovering. And you might not have your mom there to mother you while you become a mother.
Right.
So I always strongly recommend any sort of support that you can get. Is just really important and really helpful.
Mhm. Yeah, I totally agree with that. Is there any last thoughts you want to share with women listening about belly binding? Are there any women that may not benefit from belly binding?
I mean, as with anything, certain things may not be for everyone.
Right.
If it's something that interests you, I suggest, looking into finding one and trying it out, because I think that it's really beneficial, and I've heard a lot of really positive responses from my mamas.
Mm-hmm.
But if it's not for you, it's not for you. But why not try it out? See how
exactly.
Right?
And I think that's what's really cool is that you mentioned that this is helpful for women no matter what type of birth they had. This can still be a really helpful, supportive physical support for the woman as she's recovering physically.
Exactly. I mean, no matter what birth she's had, she still grew a child in her body, and she still, went through the pregnant state. So no matter what, we want to return the body back so that we can be the best mom we can be.
Yeah. And, one more thing I wanted to mention, you had briefly talked about the organs. Those get moved around so much during the pregnancy. And, it makes sense that this could just help everything kind of settle back to where it belongs in a quicker manner.
Absolutely. So everything's shifted and tilted and squished, right? Yeah. So, our body ultimately will get us back to where we need to be, but if we could have a little aided, extra support to kind of more quickly bring our body back, I think a lot of moms are like, I just want my body back. It'll just make me feel better, And why not? Let's, if there's something out there that can help us get that body back so they feel better and they can move forward, I think that's a great option.
Right. So there's the physical, but there's even like maybe an emotional component as well of just feeling slimmer and and getting your hourglass figure to come back to where it was.
I mean, after all, we are women.
Yeah.
And we do, think about our bodies a lot. And your body changes so much in pregnancy that I think, emotionally it feels really good to kind of get a little sense of self back.
Right.
Even with regards to your body image, Yeah.
Yeah, that's so true.
I think pregnancy through and through has a lot to do with physical and a lot to do with emotional, and they go hand in hand all the time.
Right. That's right, because the mind and body are so intimately connected, we really can't separate them.
Mm-hmm.
Well, Jessica, thank you so much for coming on the show today. I really am happy to get more information out to women about belly binding.
Thank you so much. I really appreciate it.